Hi, I'm Madison.
I'm Emily.
I'm Taylor.
I'm Gabrielle.
I'm Ashley.
I'm Kennedy.
And we did our study on the effects of the COVID-19 isolation mandates on the mental health of the elderly population. The elderly are a high-risk population for contracting the virus, so many have been in isolation for over a year in an attempt to decrease the risk of transmission. This has kept many of our elderly from being around their loved ones for prolonged lengths of time.
The purpose of this review is to answer the question of what effects social isolation has had on the psychiatric health of the elderly. This knowledge is important to the nursing practice because this understanding will allow nurses to provide better care and be better advocates for their elderly patients.
Databases used were PubMed, CINAHL Complete, and ScienceDirect. Boolean operators used were and or. The search terms we used were elderly, COVID-19 or coronavirus, isolation, loneliness, mental health, geriatric, and social isolation.
We found that the psychosocial health of the elderly population greatly deteriorated after the COVID-19 outbreak. The elderly showed more distress through the pandemic and had a notable increase of the use of anxiolytics compared to the younger populations. The elderly experienced significant increases in loneliness, anxiety, and insomnia as a result of social isolation. Additionally, females and those with multiple pre-existing health conditions were found to have an even greater increased feelings of loneliness. Furthermore, there was an increased incidence of dementia in those that lived alone during the pandemic.
Some of the limitations of our study include that some isolation studies did not specifically correlate their findings with the pandemic, and other studies were conducted on sample sizes less than 150 participants.
The overall purpose of this study was to understand how the COVID-19 pandemic has affected the mental health of the elderly population. In the process of our research, it was found that the elderly population was affected negatively overall in comparison to other age groups. Conducting studies on young to middle-aged adults to see how each population is affected specifically would be a great study for comparison. Thank you.